I'm Anise Davis White, and I am the CEO and sole member of The Caring Heart. And we are a care management practice that is serving the greater Kansas City area. And by that I mean that we serve Kansas City proper, which is Jackson County. We also serve Cass County in Missouri and Clay counties in Kansas because they're so close together, the Missouri and Kansas line, that we also serve people in Kansas. And that would be Wyandotte County, and all of Johnson County, Kansas. We are a business that has been around for the last 13 years. We started in 2000 and we are now in our 13th year. As care manager, we are somewhat multifaceted in the sense that we provide assessments, reassessments for families who are upset, overwhelmed. They are not able to determine where they need to go. And we find that the psychosocial assessment is a good guide for families. And it is an excellent tool. We're able to kind of map out some future for their loved one and give them a good care plan as to step by step how we should proceed. We also carry long distance caregivers. And that means that possibly an adult child who is the power of attorney may live in California, but mom may live in Leawood or Leawood, Kansas, or Overland Park, Kansas, and they need eyes to and a person who is there that can tell them, listening and seeing that person, what's going on with mom. And we do a lot of those for individuals who are far away. And what we do is we try to see them as often as necessary. That might be 1 week, that might be twice a month, it might be twice a week, whatever that person needs. And you have the face-to-face contact that you're able to then tell the loved one and write to the loved one. And even sometimes we provide a picture of their loved ones just to show them how they are doing. But they get accurate and current information. And so we have a lot of people that we carry for them who are out of state. Also, we provide consults for families who may be in town. And that may sometimes we may have to mediate at some point in time, but what we try to do is get them focused on what they need to do and divide the type of care that the person is needing. Sometimes that works, sometimes it doesn't, sometimes it falls on one individual in the family, which happens many, many times. The other people are too busy and they want to depend on that person. Well, that person who carries that load has a good sounding board with a geriatric care manager, gives that person support, able to talk to them, able to help them to discern what is happening with their elderly. We also are good resources within our particular area. And so therefore, sometimes we might have to assist people in placement. Sometimes that might be a nursing home, a long-term care, or it may be an assisted living. And even sometimes it's an independent senior community, just depending on what the person is in need of. We have a portion of our practice that provides in-home services. We are not home health. I'm personally a gerontologist. I like to call myself a social gerontologist. and have been in the field of aging for about 35 years. And so have been on a different segment of aging, from home health as a medical social worker with a geriatric patient to community-based services. Also served as the director of the Area Agency on Aging, and directed or administrated a nursing home facility. I am still licensed, and I am a professional geriatric care manager, in the sense that I am certified to do the work. So we do a lot of different things, and being in care management, you look at the individual, you look at the needs, you help serve the family. We are cost effective. If you know what you need to do, we can direct the family to more cost effective kinds of services. We also provide quality care for the individual. We enhance their lives. At the Caring Heart, we believe in customer service, customer service, and customer service.
So what sets you apart from others in your field?
Well, first, I want you to know that I have the greatest respect for professional geriatric care managers, because we have a hard job, and the professionalism is always there, and it comes out. I hope that with the Caring Heart, that we epitomize what our name says, that we are caring, and that we go the one step above. Our thrust is always to serve our client, and then to look at things in the future that they may need, they don't even know that they need. And so therefore, we want to satisfy them and then go up and above things that they are not even aware of that they might need. That we want to always be thinking of what comes next. And in the meantime, always being patient, kind, caring, and providing quality care. And again, we pride ourselves in customer service, and customer service.